Welcome back to Indiana Newsdesk. The U.S. has fewer hospital beds and doctors than most developed countries, so how are they making preparations and building capacity in response to the coronavirus pandemic? Brian Shockney, the regional president of IU Health, joins me now. Brian, first of all, thank you so much for joining me. I know how busy you are right now. IU Health confirmed last night it was treating a patient for COVID-19. Can you just tell us a little bit about the case and how the hospital went about that?
Yeah, so this patient came to us on about approximately the 15th of March, and we were already under what we call our incident command. So this is something that we stand up. We practice these drills twice a year for disasters, and so we had already all of our protocols in place. So the patient came, did not pass the screening questions, the 3 questions we asked, masked the patient, and from then on cared for the patient as though they were a coronavirus patient, a COVID-19 patient. That patient, then we sent the tests off to the Indiana State Department of Health, and after several days they were able to give us a positive result. That's the State Department of Health then contacts the local health department of the county of residence. So this individual lived in their residence was Owen County. So they released the statement. Of course, media and everything went wild, social media at that point, and so we released our statement last night that we're caring for that patient.
And how's the patient doing? Okay.
Doing well.
Can you talk a little bit about how many beds, ICU units the hospital has? You know, this is what everyone's talking about.
Yeah. So we, again, we drill for this on a regular basis. And so we've been under incident command since March 9th from the IU Health statewide all the way through. So we do a continuous inventory every day and 3 times during the day. And then we now have a live dashboard that tells us how many beds there are across the state of Indiana, how many ventilators there are, all of those things. And so we've been increasing our negative pressure rooms throughout the hospital. We have our COVID-19 unit where we cohort all our patients that would be suspected or confirmed, where we will care for them, and then all of our ventilators as well. We've skinnied down all our operations to do nothing but care for these patients and care for what we know is to come, hopefully in a much lower level than what we've seen in other states, because we're doing the right things in our community.
And then testing kits, of course, have been the other big talking point. Are those becoming more available now at the hospital?
They are. So we were in phase 1. Phase 1 of testing was your State Department of Health doing the testing, and now we're in phase 2 where we're seeing tests being developed by others. Indiana University Health now has testing available. We're testing our healthcare workers, and we're also testing high-risk patients. And then there are others around the state that are starting to do drive-through testing and those kind of things. That's phase 3, where we're able to test the general public. And so phase 2 right now is making sure those that meet the criteria for testing actually get that testing priority.
And just really quick, is the testing just a swab of?
It's a swab in your nose.
In your nose, okay.
Yep. And then we send that off, and
All right. Well, thank you very much for being here. Appreciate all of the work you're doing.
Thank you.